Good day, everyone. This is Rick Ian Rumbelong. I am assigned to discuss Echinococus granulosus. In this video, we will go further to its characteristic, life cycle, disease causes or diagnosis, symptoms and treatment, and lastly, prevention and control. Echinococcus granulosus is also called hydatid worm, hyper tapeworm, or dog tapeworm. It is belong to class Cystoda. Echinococcus granulosus is cystodes whose life cycles involves dogs and other canids as definitive hosts for the intestinal tapeworm as well as domestic and wild ungulates as intermediate hosts for the tissue invading metacystode stage. This tapeworm forms three different developmental stages: eggs, larvae, and adults. Adult E. granulosus worms are small. It ranges 2 to 6 mm long and have a scolex with only 3 attached segments. The scolex has 4 lateral suckers and the rostilium is non-retractable and armed with a double crown of 28 to 50 recurve hooks. The encysted larval stage is known as bladder worm or hydatid, and it produces multiple infective stages, either directly from the germinal layer of the cyst wall or by sacs. By endogenous or exogenous budding of the germinal layer, E. granulosus forms fluid-filled unilocular cysts with endogenous budding of brood capsules. The eggs are typical for most tynid species and are small around and round. It ranges 30 to 43 micrometer in diameter. Thick shield and contain a hexacanth or 6-hook embryo or oncosphere. Adult Echinococcus granulosus are found in the intestines of canines, such as dogs, wolves, or dingoes. It can also be found in lions. Echinococcus granulosus larvae are found primarily in the lungs and liver, but may be found in any organ of the intermediate host. These hosts include sheep, moose, camels, warthogs, and reindeer. Humans are most often infected with the hydatid cyst in sheep raising communities. Accidental ingestion of E. granulosus eggs result from humans touching dogs that comes in contact with livestock. The life cycle of Echinococcus granulosus is illustrated in my PPT. The life cycle of this organism outside of a human can be summed up in 6 stages. The adult Echinococcus granulosus, which is about 3 to 6 mm in length, resides in the bowel of its definite host. Gravid proctolids release eggs that are passed in the feces. These eggs are then ingested by a suitable intermediate host, including sheep, goat, swine, cattle, horses, and camels. The eggs then hatch in the bowels and release oncosphere that penetrates the intestinal wall. This oncosphere then migrate through the circulatory system to various organs of the host. At the organ site, the oncosphere develops into a hydatid cyst. These cysts enlarge gradually, producing protoscolosis and daughter cysts that fill the cyst interior. These cyst-containing organs are then ingested by the definite host, causing infection. After ingestion, the protoscolosis evaginate, producing protoscolaxis. The excolaxis of the organism attach to the intestine of the definite host and develop into adult in 32 to 80 days. The life cycle then continues in human. Humans can become infected if they ingest substances infected with Echinococcus eggs. The eggs then release oncosphere in the small intestine. At these places, oncospheres migrate through the circulatory system and produce hydatid cysts. Echinococcosis is a parasitic disease caused by infection with tiny tapeworms of the genus Echinococcus. Echinococcosis is classified as either cystic or alveolar echinococcosis. Cystic echinococcosis also known as hydatid disease, is caused by infection with the larval stage of Echinococus granulosus. A 2 to 7 millimeter long tapeworm found in dogs are the definitive host, and sheep, cattle, goats, and pigs are the intermediate host, although most infections in humans are asymptomatic. Cystic echinococcosis causes harmful, slowly enlarging cysts in the liver, lungs, and other organs that often grow unnoticed and neglected for years. Infections in dogs may be diagnosed by the detection of eggs and occasionally worms in facial samples. Immunocoprological tests have also been developed to detect parasite antigens in facial samples. Infections in intermediate hosts are generally diagnosed well after the larval have encysted. Clinical symptoms of a slow-growing tumor accompanied by eosinophilia are suggested. Cysts may be visualized by various medical imaging techniques. Computerized axial tomography or CAT scans, X-rays, ultrasounds. Several immunoserological tests have been developed to detect host antibodies against crude and purified parasite antigens, and an intradermal test using hydatid fluid has been used in surveys. There are several symptoms in cystic echinococcosis. Signs depend upon the site of infections. Liver cysts cause abdominal pain or palpable mass. Jaundice may occur if the bile duct is obstructed. Rupture into the bile duct, peritoneal cavity, or lung may cause fever. Urticaria or a serious anaphylactic reaction. Pulmonary cysts can cause cough, chest pain, and hemostasis. Brain and spinal cord cause epilepsy and blindness. In the past, surgery was the only treatment for cystic echinococcal cysts. Chemotherapy, cyst puncture, and PAIR, or percutaneous aspiration, injection of chemicals and reaspiration, have been used to replace surgery as effective treatment for cystic echinococcosis. However, surgery remains the most effective treatment to remove the cyst and can lead to complete cure. Some cysts are not causing any symptoms and inactive. Those cysts often go away without any treatment. And there's also medicine to treat these cysts. Prevention and control. The best way to prevent the seismic echinococcosis in humans include regular mass treatment of dogs, regular treatment of infected dogs to reduce worm load, elimination of stray and infected dogs, prevention of dogs eating infected offals of sheep or cattle, strict personal hygiene, avoidance of contact with dogs. Special hygienic principles must be observed when handling dogs in endemic areas. And that's all. Thank you.